Good morning. This is Dr. Tariq. Today I am going to talk about muscular system and some medical terms. The word root for muscle is myo or myzo. Myo and by myo combining form, and the word we can make is myalgia, pain in the muscle. Myolysis or myolysis, destruction of the muscle or separating the muscle from the surrounding adhesions. Myolysis. Myorexis, rupture of the muscle. Myography, this is stitching of the muscle. When there is rupture, we have to stitch it. Then is myoplasty. Sometimes the muscle is damaged in the accidents and we have to do some plastic surgery. This is known as myoplasty, plastic surgery on the muscle. Myosclerosis, so the muscle is hard. Sclerosis means hardening of the muscle. Then his word is polymyalgia. Poly mean many, my mean muscle, algia mean pain. Pain in many muscles. Myositis, inflammation of the muscle. Next word is fascia. Fascia. Word root is fascia and meaning is fascia. This is a muscle, a group of red cells which are long and they are known as cell fibers, muscle fibers, because they are long. A group of fibers, long fibers, is known as muscle. So this is a muscle which is surrounded by a brown line, that is fascia. Fascia is the covering and support of the muscle. So word root for fascia is fascio, fasciitis, inflammation of the fascia, and fascioplasty. It is, if it is ruptured, we have to do some plastic surgery over the fascia. The next word is movement, kinesi. Kinesi means movement. We are talking about muscles. Kinesi is movement, and the first word is hyperkinesia, excessive movement, and hypokinesia, less movement, diminished movement. When we say less or more, we always comparing with normal. So hyperkinesia means more than normal movement, and hypokinesia means less than normal movement. And the third word is dyskinesia. So this is abnormal movement or distortion of the voluntary movement. Then the word is rheumatologist. Rheumatologist is a specialist of the rheumatic tissue. He diagnoses and treats the diseases of the rheumatic tissue that contains bone, muscle, tendon, ligament, and some soft tissue surrounding it. The other word is orthopedic surgeon. He is the one who does surgery on connective tissue like bone, muscle, tendons, and ligaments. And next word is neurologist. Neurologist is the specialist of the nervous system that contains brain, spinal cord, and their branches. Troph. Troph means growth. There are three words: hypertrophy, hypertrophy, and dystrophy. Hypertrophy means overgrowth. Troph means growth, and hypertrophy means overgrowth. You see, bodybuilders, they overuse their muscles. They exercise too much, and their muscles become big. The rule of the muscle is if you use them, they will remain normal. If you overuse them, they will hypertrophy, and if you not use them, they will become atrophic. So you see big muscles of the weightlifters, and then when somebody has fracture, his leg is put into plaster of Paris for 6 weeks or 2 months, and then you open the plaster, the muscles are atrophic because 2 months muscle have not been used, and then we have to do physiotherapy again. This is movement, exercise, and the muscle will regrow. So the rule of the muscle is when you use them, they will overgrow. When you not use them at all, they will atrophy. They will become less. They will diminish in size. Here you see, this is the diagram of a muscle and a bone. This is the place where the muscle is starting, and when muscle goes to the end, it tapers to a connective tissue, cord of connective tissue that is known as ligament. This is muscle. It is starting from here. Where it is starting, that is known as origin, and where it is joining, that is known as insertion. The origin is always fixed. It does not move. This is the one which moves. When it is flex go up, this will move. When go down, this will move. This will remain stationary in flexion and extension, both movements. So tendon is a connective tissue cord of connective tissue that connects bone with muscle with the bone. So this is a tendon. It's a cord that is connecting muscle with the bone. You have to remember this is very important. And the other word is ligament. Ligament is again a cord of connective tissue. Both are cords of connective tissue. Tendon connect muscle with the bone, but ligament connect one bone with the other bone. That is the difference. Ligament connect bone with the bone, tendon connect muscle with the bone. Injury to the tendon is known as strain, S-T-R-A-N. Injury to this tendon is known as strain, and injury to the ligament is known as sprain. Injury to the tendon is known as strain, injury to the ligament is known as sprain. So this is all about muscle. Thank you very much.